COVID has actually changed accessibility of the workforce. It almost feels like as a spaceship's come over planet Earth and sucked a lot of people off it. A number of people towards their elderly years decide to retire early. They've seen the impact of COVID. They've realized we're vulnerable as human beings. They've decided for their life balance, they don't want to work any longer.
COVID has been a gift. There's no doubt that it's exhausted our staff and pushed them and tested them, and it's had a real impact on our workforce. But it's also been a gift because at that local level, the collaboration that occurred, the cross-agency actions, the working with the Aboriginal Controlled Medical Services, it was just fantastic how everyone just came together to really get a high level of vaccination, to have emergency plans in place for, should COVID hit a community.
But what it's taught me is actually you need to create a preparedness around being flexible and agile. But I don't think we can actually set out a rule book for how we'd exactly deal with what comes next. COVID taught us we didn't know what to expect.
I think Australia was actually not too badly prepared for the pandemic. If you look at our response, it was pretty good. We are fortunate in that we are an island, but we're quite a well-trained jurisdiction in terms of most states have statewide disaster planning. So I think our response was about as good as you could expect under the circumstances we had.
But it's also affected society. Our degree of risk we're prepared to accept, the way we travel has changed, the way we even interact with people. Some people still bump me on the elbow rather than shaking hands. So society's changed. I think we'll probably take another 5 years before we've moved away from COVID in a full way.